Hi, everybody. My name is Megan Sutton. I'm a nurse practitioner. I specialize in heart failure and cardiomyopathy. I worked clinically managing patients for many, many years before joining the research division of pharmaceutical companies that were working specifically to innovate in heart failure and cardiomyopathies. I've worked on therapies like Entresto for heart failure, mavacamten for hypertrophic cardiomyopathy, and more recently, I've worked on gene therapies for genetic cardiomyopathies. My current role is at Evergene, where we offer free testing for patients with genetic cardiomyopathies. The topic today is really to have all of you understand why it's so important for you as a patient with cardiomyopathy to consider getting tested and why this could directly change the care that you'll maybe be receiving. So the information that I'll go through today is reasons for testing, as well as clarifying what a cardiomyopathy is, so that you can better understand what it is and how you can potentially get treated. So what is a cardiomyopathy? I think that this terminology gets thrown around a lot. You may have heard the terminology ischemic cardiomyopathy, and I think that causes a sense of confusion of what cardiomyopathy truly is. And what cardiomyopathy is a disease of the heart muscle. And what makes it specifically different is that it comes in a way that isn't caused by the most common things like a heart attack or high blood pressure or valve issues. This is something where you have a disease of your heart muscle, and it's really kind of somewhat unexplained. And what we're learning is that genetics play a very large role in these cardiomyopathies. And you may have heard the term hypertrophic cardiomyopathy or dilated cardiomyopathy, arrhythmogenic cardiomyopathy, or restrictive cardiomyopathy. These are all different types of diseases of the heart muscle in which the cause is somewhat unknown and not related to things like heart attacks or hypertension. And so, like I said, what we're learning is that a large proportion of these are genetics. And as we learn more about the genetic piece of this, the more we understand how we can alter and tailor treatment based on the genetic background. So what I want to go through today, I guess, as I mentioned, is the reasons why you should get tested. So assuming that you have a diagnosis of cardiomyopathy, a physician in your healthcare team has diagnosed you with what you see on this slide here, cardiomyopathy, a disease of the heart muscle that was not caused by the common things like blocked arteries, high blood pressure, valvular issues. Now you have a diagnosis of cardiomyopathy. Now you might want to consider genetic testing. This is why testing matters. So I mentioned that a large proportion of patients that have cardiomyopathies should have a genetic testing because most likely you will have a positive result. You can see now by cardiomyopathy type, the percentage of patients that we know now have a genetic part that has caused this issue. So in hypertrophic cardiomyopathy, it's about 35% of patients that have this. It's actually a range between 30 and 50. When it comes to dilated cardiomyopathy, the range increases a little bit there. You see 45%, that's the middle of the range, but about half of the patients with dilated cardiomyopathy are known to have a genetic component. And that increases even higher when it comes to arrhythmogenic right ventricular cardiomyopathy or arrhythmogenic cardiomyopathy, as it's also called. So those patients actually have an even higher rate of genetics as a background for their disease. And so you can see that if you haven't been tested, this information, once you get tested, may help you get a more precise diagnosis and potentially tailor your treatments for this. So let's go ahead and get into the specific reasons why you should consider getting tested now that you've been diagnosed with a cardiomyopathy. So reason number one is about defibrillation. You might have heard of something called an ICD or an internal cardiac defibrillator. A lot of these cardiomyopathies carry the risk of having irregular heartbeats. And so what that can cause is your heart not to beat properly and things like you may pass out, and you may even be at risk for something called sudden cardiac death, where your heart stops because that rhythm is irregular. And so we know now that certain genes that cause these cardiomyopathies are at higher risk for this. And based on the expert guidelines, there's now guidance that says if you have a particular gene in a particular cardiomyopathy, you really should be considered to have an ICD, one of these internal cardiac defibrillators. And so this is specific guidance that's based on your gene. And so if you don't get tested, then you don't know your gene. And then you won't necessarily get the precision treatment that you need. Another example is that you might be able to see the right specialist sooner. And so testing can actually not only tell you what the genetic cause of your cardiomyopathy can be, but because of that genetic cause, it can lead you to having a more specialized care. So you can see some of the examples here. using PKP2 as an example, or SCN5A. These are genes that cause those rhythm issues within your heart, so you'll have those abnormal heartbeats. And that may be something that if you're diagnosed with this, you really should see a rhythm specialist or an electrophysiologist to evaluate you for something like an ICD. LAMP2 is another example here. That's a different gene that causes cardiomyopathy, something called Danon disease. And so you may be referred to a metabolic specialist or have a genetic team evaluate you and your family, as these are all hereditary things that get passed down. Some other examples are genes like BAG3 and RBM20, and these are genes in which they're known to have heart failure progress more quickly in these patients. And so having a specialist in heart failure evaluate you if you have one of these genes can actually help slow your progression of heart failure so that you can get specialized treatment for heart failure and the right care that you need. So this is just one of the many examples in which gene-specific diagnosis can give you gene-specific treatment. Here's another reason here. We talked a little bit about specialists that you'd be referred to. These are examples of tailored treatment. So these are just some of the many examples in which different genes may actually require you to get a different treatment, different medication, a different therapy. So when it comes to Titin, these are actually well managed with the current heart failure therapies. And so that's important to know if you have Titin. Things like Entresto and beta blockers will help patients with Titin. Things like lamin A, if you have a lamin A genetic variant in cardiomyopathy, these are patients that are at risk for those rhythm issues, and they may benefit to have an electrophysiologist evaluation and consideration for an ICD. And the last mutation here is an HCM mutation. There are many clinical trials now for gene therapies. This is just an example of one. And so if you are diagnosed with a specific gene variant, you may want to consider learning more about the clinical trials that are available for the specific genes, as gene therapy is a very promising new therapy type for gene-specific cardiomyopathies. Reason number 4 is early monitoring. So we know that with these cardiomyopathies, they can be progressive, which means getting worse with time. And so if you get a diagnosis of one of these specific genes, the clinicians and your care team can watch you more carefully. Maybe that means that you need annual MRIs. Maybe that means you need more frequent Holter monitoring so that they can tailor your treatment as things progress. If they don't know what gene you have, they won't know how necessarily to monitor you specific to that gene type. Some genes are different than others and require different monitoring. And so this is an example of getting tailored treatment to what your underlying cause of your cardiomyopathy may be. And last but not least is the familial piece. So if you have not gotten tested, but you have cardiomyopathy, and then you get tested and you have a positive result, it's really important that your first degree relatives get tested as well, as these genes are often passed down to family members. And why that matters for your family members is even if they don't have the disease, they may be at risk of developing the disease. And so one, you should get your family members tested as well. Getting you tested will help us understand whether your family should get tested. If you are positive and you get your family tested and they are positive, then they can also get care, right? So they can get the monitoring that they need, they can go to the specialist that they need, and they can potentially get treatment earlier to prevent the progression of disease. So it's important that not only you get tested, but if you're positive, your family gets tested too. So there's certainly a family benefit with that. So just to summarize this, I think it's important that one, you understand what a true cardiomyopathy is. You understand that the underlying cause of many cardiomyopathies is genetics, and that if you choose to get tested, it's actually a great tool for you and your clinical team to be able to help you get specialty care based on your gene. What has really changed over the last decade or so is that we are starting to understand that all of these genes are very different. They have different pathways and characteristics of the disease and different treatments. And so it's instead of receiving generalized care, it's really important as an opportunity to get genetic testing that will reveal the variant that you have and allow the clinicians to give you customized treatment and catch these problems sooner and earlier so that you can monitor over time and prevent things that could happen in the long run that would happen if you didn't get treated. Just as a wrap up here, to make sure that it's clear, genetic testing is a very powerful tool to identify the underlying causes of this. And as I mentioned, it can customize your treatment and your care, not just for you, but your family. So it's important to recognize this is not just about you, but your family and their family. And so this can help you make informed decisions with you and your clinical care team to do the best for all of you.
This video is part of a series of educational videos developed by the Genetic Cardiomyopathy Awareness Consortium and brought to you by the DCM Foundation. Our goal is to connect you with the leading experts in the field of cardiomyopathy to further your understanding of this disease and to provide resources to help you manage your care. Thanks for watching.